welcome back to Inside Guelph. We're talking about a very important issue. It's called management of medication for seniors, and joining us right now, Marie Graham. Thanks for being here.
Thank you.
So this is a big concern, especially with the aging population. We're starting to see maybe taking some forward thinking and some planning. Where does management of medication go awry?
Well, what can often happen is when people go to their physician, they get a new prescription and they're not always clear that maybe they're supposed to stop another medication or that they should be taking them together. As well, sometimes, you know, if there are some cognitive issues, sometimes people forget to take medication or they're feeling good, so they think, well, I don't need to take my medication anymore.
Oh. That's not a good thing.
No,
that means the medication's working. If you're feeling good and you feel like you don't need the medication, that probably means it's working.
Yes, and one of the things you need to do is keep taking that medication unless your physician has advised you otherwise.
This is it. Now, if we're going to GPs, this is my question. As a senior, and I'm being prescribed new drugs, is there such a thing as a medication plan? Are they being sent home with a plan?
Well, you know, sometimes when they go to the doctor, people are somewhat reluctant to ask questions, so would really encourage people to maybe prepare questions prior to going to the doctor and then get the prescription. But it's also good to have a health professional review medications, and that could be a nurse going into the home reviewing all of the medications. Always keeping handy when you go to the doctor a list of all the medications you take. And it's also good sometimes to just take all your medication with you, and then the doctor can see exactly what you are taking.
Great idea. Now, what about for the generation that is now dealing with an aging parent and their concerns about perhaps loss of memory and that sort of thing? Would you suggest buddying up when you're going to doctor's appointments at this point?
Yes, it's always good for somebody to go with the person to the doctor because, you know, sometimes you're given a fair bit of information that can be overwhelming, and therefore it's important for someone else to be there because they might think of questions. And it's also great to have somebody make notes as well so that, you know, you can go home and digest that.
Okay, what kind of questions should they be asking their GPs?
Well, they should be, first of all, explaining all the symptoms that they have, and then asking questions about what side effects they can expect, so that if they have those side effects, they'll think, okay, well, this is normal or this isn't normal, and if it's not normal, they need to get in touch with their doctor again. Okay,
what are we talking about when we're talking about mistakes in medication? I mean, it's serious. We're not just saying maybe one extra sleeping pill. What sorts of things are you seeing?
Well, one of the things that we tend to see is that people may be taking too much or not enough medication, and they feel dizzy. That can lead to a fall, which can lead to a fractured hip, which can lead to hospitalization. And unfortunately, this is also the result of about 21% of people that are admitted to long-term care facilities. So if we go back to the very beginning and prevent all of that, then obviously people can stay more independent in their homes.
That's a huge percentage.
It is, yes.
That's almost a quarter. I mean, that's a big, big deal. So if you can manage your medication, and the goal being long-term independent living, correct?
That's right, yes.
Are the hospitals, do they have a plan or some sort of support for people who are hospitalized due to mismanagement of medication? Is there something to reduce that sort of error once they're released?
Well, again, there's a number of things. Like, for instance, you can have your pharmacist put all of your medication into what's called a blister pack, and that is very clear. So if it's Monday, these are my 8 a.m. pills that I can punch out. If it's noon, these are the pills I take. So that's very clear to people around what medications they do take. There's also, if you were to go to the website My Health Nurse Check, .ca, there's a document there that you can print off and list all the medications that you're on. So just to help you keep track of that, as well as to share, you know, with family members that you want to have good understanding of your health issues.
What other tips do you have for seniors, as well as those caring for seniors, to increase the likelihood of independent living?
Okay, so another thing is to have someone come out into the home and do like a health consultation where you can identify issues. And some of those things are doing a fall risk assessment. So looking at things in the home that might cause a fall and things that you can do to put in place to prevent that. So for instance, taking up small rugs off the floor that a person can slip on, making sure you've got grab bars in the bathroom to hang on to. The other thing is to do a mobility assessment. So maybe the person is fine in the home, but if they're outside, maybe they should think about using a cane or a walker. So again, for balance. And that's not to take away independence, that's to give you support so that you can continue to be independent and live in the community.
That's a great, if it's said that way, that this is about increasing independence, it's not taking it away, that maybe that's a bit easier to digest.
Yes, that's
now
right.
It's My Nurse is what people can look into. That's one program of nurses that will come into the home. But they should be asking GPs, bringing in family members. So if I understand right, you're saying plan.
Absolutely, and talk about it. Talk about it with your children, talk about it with your parents. And then again, sometimes people need a little extra help in the home through home care services. And that's a good thing too, again, to give you independence. It's not to take away your independence.
Thank you very much. It's a very important issue. Thank you for being here and talking about it.